This is Radio Now 95.3 FM. Come for the news, stay for informed conversations.
Lagos continues to battle a cholera outbreak that has claimed 15 lives so far. The State Ministry of Health says of the 350 suspected cases, 17 have been confirmed to be cholera. As the state pre-positions cholera kits in health centres in Lagos, the Commissioner for Health, Akin Abayomi, says cholera cases are significantly declining. The Commissioner is calling on residents to practice improved sanitation and has promised free medical treatment at all government hospitals for reported cases of cholera. Joining us this morning to discuss the public health approach of the state is public health physician at the Lagos State University Teaching Hospital, Dr. Blossom Maduafokwa. Good morning and welcome, Doctor.
Good morning. Thank you so much for having me.
It's a pleasure to have you on. We've had conversations on the cholera outbreak a couple of times and in many different ways, but this morning we want to stick with the state approach, right? How exactly the government should tackle the best way to tackle the cholera outbreak. We hear there are declining cases. Speak to us on what the initial steps typically are when you have an outbreak in a state.
Okay, so when an outbreak is declared, there are certain emergency responses that immediately kick in. So that was what happened in this case. So really, behind the scenes, we have what we call an emergency operations center, which is usually in place. But once an outbreak is declared, activities kick in, particularly investigation, to find out exactly where the outbreak is coming from. So one of the things that was done was to investigate, to identify where the source of contamination of water was coming from. And what usually happens is once that is identified and eliminated, the cases begin to drop. Another thing that we've done during the response is to seek cases of cholera, to try and find what we call case finding. So finding cases and making sure they get isolated and treated. Also identifying their contacts and putting extra surveillance on their contacts to make sure that once they develop symptoms, they immediately get treatment. Another thing we've done is to train healthcare workers. Actually, a few weeks ago, I had to undergo an infection prevention control training so that healthcare workers know how to first protect themselves and how to handle these cases when they come in. So these responses have already been taken and are currently ongoing.
Doctor, what are the chances of containing a disease as contagious as cholera?
Yeah, so once the actions that I've outlined are taken, it's a matter of time before the outbreak is controlled. I mean, this is not the first cholera outbreak we've had. We've been having cholera outbreaks since the 70s. So usually around, I don't know if people have observed, usually around the rainy season, we tend to have more of these outbreaks because of the rain, the floods, wash infected material into sources of drinking water. People drink the water and you have these outbreaks. So usually what happens is once we kick in emergency response activities, surveillance, case finding, treatment, risk communication, like what I'm doing right now, informing the public, getting the public sensitized to personal hygiene, avoiding open defecation, drinking, boiling your water, the outbreak begins to abate.
So, Doctor, from a public health perspective, right, if we were to put structures in place, how do we minimize further outbreaks or even just eliminate them altogether?
That's a great question because people actually don't realize cholera outbreaks used to happen very regularly in parts of Europe and parts of the UK, in London actually. Even in the last century, they used to have regular cholera outbreaks. But this is what they did, and it's actually not rocket science. They just instituted proper sanitation facilities. Because cholera, one of my colleagues likes to say, cholera is a respecter of person. Cholera respects personal hygiene, and cholera respects proper sanitation facilities. So once you have proper sanitation facilities, you don't have sewage accessing sources of clean water and contaminating clean water. Really, cholera outbreaks will be a thing of past. So the main thing that can prevent future cholera outbreaks is proper sanitation. We implore people all the time, avoid open defecation, because what usually happens is feces contaminated by cholera, people defecate openly. When you have the rains, the floods, it washes into sources of water. People drink the water. People, if you go to the market, people use the water to wash fruits and vegetables and sell to the public. So these are the sources of contamination. And if you can provide proper sanitation, we're able to control overcrowding. We will be able to eliminate cholera in this environment to a great extent.
Dr. Madu Afokwa, thank you very much for your time and your expertise on this conversation. Dr. Blossom Madu Afokwa is a public health physician at the Lagos University Teaching Hospital, and she joined us this morning to speak on the cholera outbreak in Lagos, which has so far claimed 15 lives. The State Ministry of Health says that 350 cases are suspected and 17 have been confirmed to be cholera. As we continue this conversation, it's important that we ask you to continue to maintain good personal hygiene habits and to avoid open defecation, as these have been identified as the causes of this outbreak we're currently dealing with. You're still on to Radio Now 95.3 FM Lagos. The conversations continue in just a moment.
This is Radio Now 95.3 FM. Come for the news, stay for informed conversations.